I am Dr. Niroop MBBS and MD in pharmacology. I have been experienced in doing a lot of bioequivalent studies wherein we exactly measure if two drugs are having the equal amount of action on a body. For example, like you have two different companies like Dolo as well as Crocin or Calpol. Do they all have equal effect or not? This is the kind of studies I've been doing in my past, bioequivalent studies. So during these times, I have always come across some situations, especially in rural India, wherein there is this problem of spurious drugs, which have been a major problem. Like you have a branded medicine which costs about 100 rupees for around 10 tablets, and you have the spurious medicines which costs only around 45 rupees or 50 rupees for 10 tablets. So what is this a common man's or a poor man's thinking is that you go for a cheaper medicine thinking that it will give the same effects. But when we do these bioequivalent studies, we identify that the branded medicines or a medicine approved appropriately from the regulatory agencies have around 95 or above 80% of the active ingredient. But the spurious medicines, they have a terrible or a very minimal amount of active ingredient of around 30% or maybe 35%, or at times we have never found an ingredient at all. So please be aware of all these fake medicines which is being circulated in the pharmacies. It is very difficult for the pharmacist also to identify this fake medicine since the name is all the same, the packaging is almost the same, and they also print these batch numbers and lot numbers, which makes it even more difficult for a patient to identify. So going for platforms like Medlife, you get guaranteed branded medicines or other generic medicines from a reputed company, or a minimum a company with all the licenses cleared. So you have an 100% guarantee that the bioequivalence and bioavailability is achieved. So a few things on how to identify fake messages is that, first of all, be very careful when the price is extremely low when compared to its counterparts. Second thing, the availability, if it's available only in one particular shop, you have to be careful about it. So probably, even I would do some more research and give you more information on this. At this point of time, this is all I would say. Please be careful about these fake medicines. Please do not go for these fake medicines. And Medlife is a platform where you can easily get all these branded or appropriate medicines at very cheaper and discounted price. Please make a correct choice, make a intelligent choice, and be safe. Please avoid fake medicines.
Medlife, आपकी न्यू एज ऑनलाइन फार्मेसी। प्रिस्क्रिप्शन शूट करो, अपलोड करो, medlife.com, डाउनलोड और कॉल